Hi guys, welcome back to my YouTube channel. It's your favorite girl, Nurse Juke. Now we'll be talking about some possible signs before menstruation. Somewhere between 5 days and a couple of weeks earlier than period begins, one can experience signs and symptoms that assist to understand it coming. These signs and symptoms are known as premenstrual syndrome. They are referred to period used to explain a collection of diverse range of physical and behavioral symptoms that some females experience before their menstrual period. Now, some female experience this, whereas some don't. And now it has to do with your physical appearance and your behavioral pattern. So this is to say there is a slight or noticeable changes a week or few days before your menstruation. It's a collection, meaning that it is not just one symptoms. There are other symptoms to get joined together that you can experience before your menstruation. Now it also varies. It differs in every woman out there. Now we're going to possible causes and contributing factor. One, multiple endocrine factors like hypoglycemia, other changes in carbohydrate metabolism, hyperprolactinemia, fluctuation in level of circulating estrogen and progesterone. Now, this hyperprolactinemia is that is high level of prolactin in the blood. Prolactin there, emia, high level of prolactin, emia in the blood. Now, when there is in fluctuation in level of circulating estrogen and progesterone, this has to do with when there is a fluctuation. So when there is an imbalance in the hormone and estrogen, it can lead to this PMS, or abnormal response to estrogen and progesterone can lead to this PMS. Now we have excess aldosterone or antidiuretic hormone. And secondly, we have genetic predisposition. This is to say that it can be inherited. It is genetic. It's found in the gene. So when prior to your period, you can develop or exhibit those signs and symptoms. And again, we have possibly magnesium and calcium deficiency. This is to say when there is magnesium and calcium deficiency, it can lead to this premenstrual syndrome. And then we have estrogen and progesterone, which can cause temporal fluid retention. Like I said, when there is an abnormal or when there is a fluctuation in the level of estrogen and progesterone in the blood. And then again, we also have serotonin deficiency. This is thought to contribute because women who are most affected by PMS have lower serotonin level. So serotonin level helps to balance one's mood. When the serotonin level in one's blood is low, it brings about low mood, or let's say it brings about depression. So this serotonin has a very big role it plays in everyone's life. So when it is low, it can lead to this premenstrual syndrome, those changes we experience. This is a depressed lady. And then we also have common signs and symptoms before menstrual flow. Firstly, we have acne flare. Most people witness or most people experience this acne a week prior to their menstruation. You'll notice this a pop out on their face, or this reddish acne that's so noticeable on their face. Okay, and then again we have breast tenderness a week or earlier before menstruation. The breast would possibly feel swollen and soft to touch. So some people or some women experience this breast tenderness. And then again, okay, this is a picture of a lady with this acne we're talking about. As you can see, it is reddish and it's so obvious, like it's noticeable that okay, for some people that understand, they'll be like, okay, she's about to menstruate. It's really, really common in some women. And then again, we have bloating, which is the fullness of stomach, the feeling of fullness of stomach. And we also have mood swing. As the hormonal level increases a week earlier, she might have this snap, or she might snap at her companion or feel satisfied 1 minute and the next minute she's unhappy. So this is a mood swing. Your mood is not stable. You're happy this minute, next minute you're sad. We have fatigue, feeling worn out. And then we have headaches. So women feel headache, and we have trouble sleeping. So women feel uncomfortable signs like this, trouble with sleeping. And then we have food craving. This food craving is very common, like in majority of women, they have this food craving, especially sugary food. A week to your menstruation, you can have this food craving of sugary food, especially sugary drinks. Anything containing sugar is what you crave for this period. So this is a sign that you're about to menstruate. And then we have joint ache, especially on your waist. And then also, okay, like I said, especially on your waist. So manifestation of the modification of the hormone prolonging to the period. So is another manifestation. When the hormonal level is modified, it can lead to this joint pain. And then we have depression or crying. So women just feel like crying for no reason. So these are the signs that she is about to menstruate. And then, okay, this is a sad lady that is having a bad day as a result. As you can see, she's feeling so sad because the signs or PMS did not really allow her to perform her activities as she should. And then we have other non-specific symptoms, which may include headache. We've said headache before, vertigo, a sensation of or one feel though they are moving or spinning around. We have prosthesia of the extremities. We have syncope, that's feeling of fainting. We have palpitation, feeling that your heart is beating fast. We have constipation. We have nausea. We have vomiting and changes in appetite. We have acne and neurodermatitis. They can also occur. And then we have some condition with similar symptoms to menstrual syndrome. Now note that all these symptoms that we've mentioned, when you feel them before, okay, note that you experience all these symptoms we mentioned a week or few days before menstruation. Now when these symptoms are exaggerated, or when these symptoms continues after your menstruation, there's every need you get yourself checked at the hospital. Like some conditions that are similar to this PMS, we have depression, we have anxiety, we have perimenopause, we have continual fatigue syndrome, we have irritable bowel syndrome, we have thyroid disease. So after your menstruation and these symptoms continues, there's every need you go to see a doctor, because these are the similar symptoms. These are some conditions that have these same symptoms. And then we have the management. So diagnosis is clinical, often based on daily recording of symptoms. Now in this case, now we treat asymptomatically. We treat based on symptoms. Like when you present with joint pain, we treat the joint pain. When you present with depression, we reassure you, and if there's any need of administering antidepressants, we can give you that as well. So depending, we treat based on the symptoms you present. And we have diet. You also need to modify your diet, especially the cravings for sugary food, because we know that sugary food has a way of increasing, has a way, yeah, it has a role it plays in menstruation, and it can lead to pain, can lead to cramp and all. It can lead to inflammation that can bring about contraction and all that, which can lead to pain during menstruation. And we have medication. Some medications can be given as well. Like I said, can be treated based on symptoms. And we have counseling, can be counseled that everything will be fine, everything will be well. And then these are some tips that you should adapt or adopt to in taking care of yourself. We have hygiene, maintain a good personal hygiene, avoid caffeine, pay attention to your body, don't push yourself so hard. Just take your time, give yourself time, and you'll be fine. Then we have conclusion. Premenstrual symptoms varies. It is important, and also the symptoms of PMS can affect your daily activities. So it is necessary to take records of positive and negative impacts it has, and also see a gynecologist if PMS is preventing you from performing your normal daily routine. And when those symptoms or when those signs and symptoms are exaggerated, when they becomes unbearable, you go and see your gynecologist. I advise you see a gynecologist when they are modified or when they are exaggerated. And then thank you so much for your attention. Make sure you subscribe to my channel, like, and also comment. And then if you have any question, you can drop it on the comment section. Share this video. Thank you so much. I remain my humble self, Nurse Chu.